This video series contains scientific and medical concepts aimed at informing healthcare professionals and does not constitute medical advice. Note to community members: we advise viewers to always speak with their medical care team prior to making any adjustments or changes to their current regimen. Please note that the videos may contain visually stimulating images and movement.
In this video, I'm going to demonstrate and also explain to you how to perform a 10-minute passive standing test, also known as the NASA Lean test. The purpose of the passive standing test is to determine the neurovascular response of the lower extremity and abdominal vasculature while standing. The reason we have patients in a supported standing position against the wall is that it reduces muscular influences on venous return, which is the major cause of variability in orthostatic testing. Reducing the muscular influences allows us to better understand just how well the autonomic nervous system is responding to upright posture. The 10-minute time frame, as opposed to a 3-minute time frame, allows for a deeper understanding of the nature of the orthostatic intolerance. This, in turn, helps to develop a more targeted treatment approach. The beauty of the 10-minute passive standing test is it can be done in your office by your clinic staff and provide you with immediate insight into one of the major drivers of this illness. The only equipment needed is a blood pressure cuff and high-quality stethoscope. Electronic is ideal, pulse oximeter, a wall, 2 clinical staff members, one to do the vitals and the other to scribe and monitor the pulse oximeter and patient symptoms. Total time of the test is about 30 minutes. The provider should review the patient's medication list and recommend which medications should be held prior to the test. Usually, medications are held 12 to 24 hours, depending on the drug half-life, before the test is performed. But some medications may need to be tapered. Examples of medications that could influence a passive standing test include midodrine or droxidopa, fludrocortisone, beta blockers, alpha blockers, pyridostigmine, stimulants, including caffeine, tricyclic antidepressants, serotonin norepinephrine reuptake inhibitors, and muscle relaxants. Tizanidine is particularly problematic as it can increase heart rate. Patients should be told that they should limit their water intake to no more than 1.5 liters before the test. They should also limit their sodium intake. However, patients should not be dehydrated before the test. Patients should be instructed to arrive in loose-fitting clothing. Any compression clothing will be removed for the test. They should also remember to bring their medications that they've held, some water, and a snack for after the test. The test begins by the patient performing a 15-minute rest period. The room should be quiet, dimly lit, and warm so the patient can relax. The patient should not read or look at their phone during this time. When they are in the standing part of the test, the overhead lights are on. Keep conversation with the patient to a minimum. Conversation should only be for instructions, asking the patient how they're feeling, and for the patient to inform the staff any signs or symptoms they're experiencing. After the test, provide the patient with a comfortable place to sit down or lie down so that they can recover. And now we'll conduct the test. When the patient enters the room, obtain a seated blood pressure and heart rate. Then ask the patient to remove shoes and socks and lie supine comfortably on a bed or full exam table in a quiet room for 15 to 20 minutes to reach circulatory and nervous system equilibrium. Offer a blanket and pillow to support their knees. After 15 to 20 minutes, turn on the overhead lights, quietly enter the room, and record the patient's blood pressure and heart rate. Repeat these vital signs a minute later. If the repeat vital signs are not similar, retake until 2 consecutive readings are relatively consistent. The goal is to determine the average resting supine blood pressure and heart rate. Then ask the patient to sit on the edge of the table or bed. Then stand straight up and lean against a nearby wall with only their shoulder blades touching the wall. Heels should be approximately 6 inches from the wall. Once against the wall, Coach the patient to relax as much as possible to minimize shifting their stance, talk, or chat except to report symptoms. Start a timer and record the first standing blood pressure and heart rate. Repeat blood pressure, heart rate, and O2 measurements every minute for the next 10 minutes. The second clinical staff member will document these vitals and any signs or symptoms the patient is experiencing on the passive standing test form. Observe patient for lightheadedness or signs of presyncope. The test can be stopped early if the patient is severely distressed, about to faint, or if the staff are concerned about severe blood pressure or heart rate readings. Observe skin and extremity for changes in color and temperature. Observe for pupillary dilation, sweating, tremors, changes in breathing, and any other signs of distress or weakness. Assess cognition. Once the test is over, have the patient move to the exam table or chair. Elevate their feet and allow time for recovery. Have them drink water, eat, and resume their medications. The 10-minute passive standing test is an incredibly important tool for assessing patients with orthostatic intolerance. It can be done very easily and inexpensively in your clinic. I strongly urge all clinicians to consider using this test as a way to screen for orthostatic intolerance so you can best help your patients. Thanks for watching. We have another video that will break down how to interpret the passive standing test on our website at batemanhorncenter.org.